Hello everyone. By the end of this video, you will gain a clear understanding of how to help a woman achieve orgasm and experience greater sexual pleasure. The purpose of today's discussion is a question I hear very frequently. Doctor, how do I find the G-spot? Or, how can I ensure my partner experiences true orgasm? This is the question most of the men ask very often, so I've decided to explain it. There is a lot of curiosity around female anatomy and sexual response. So let's break it down in a precise, evidence-based way. First, let's talk about the clitoris. The clitoris is a highly sensitive organ located above the vaginal opening with approximately 8,000 nerve endings, comparable in sensitivity to the glands of the penis due to its shared embryological origin. Its stimulation is the primary pathway to orgasm for most women. Many men assume that penetration alone is sufficient, but in reality, the clitoris must be properly stimulated first. Think of it as opening a gateway. Once the clitoris is aroused, it allows for heightened sensitivity in other areas, including the G-spot. The G-spot itself is located inside the vagina, typically on the anterior wall, 1 to 2 finger widths in. It requires direct stimulation, often after the clitoris has already been aroused. Simply inserting a finger or penis without proper clitoral stimulation is unlikely to produce orgasm. This is not a myth or a trick seen in films. Orgasm in women is a complex, multi-step process that involves anatomy, physiology, and emotional connection. Lubrication and foreplay play critical roles here. A warm, adequately stimulated, and receptive clitoris is essential. Sexual experts often emphasize oral stimulation as the most effective method, but gentle touch, massage, and penetration can also activate the clitoris, which then primes the G-spot for further pleasure. It is important to understand that forceful or repetitive penetration alone will not reliably produce orgasm. Regarding the mechanics of penetration, the penis does not naturally curve upward like a finger might, so simply thrusting does not effectively target the G-spot. Additionally, vaginal nerve endings are concentrated in the first 3 to 4 centimeters of the vaginal canal. A larger penis does not necessarily enhance pleasure beyond these nerve endings, and can sometimes even cause discomfort if it contacts the cervix. Therefore, anatomical size is less important than proper stimulation techniques and ensuring the clitoris is engaged. There is evidence suggesting that a thicker penis can sometimes provide better stimulation to the upper vaginal wall and clitoral area, contributing to G-spot pleasure. This is why some patients report that penile girth can be more important than length for sexual satisfaction. Ultimately, what matters most is understanding anatomy and focusing on stimulation rather than size alone. It is also essential to recognize that female orgasm is influenced by emotional connection, comfort, and overall arousal. A partner who is relaxed, well lubricated, and emotionally connected is far more likely to experience pleasure and orgasm. Statistically, studies suggest that up to 80% of women do not consistently achieve orgasm through penetration alone, which highlights the importance of attentiveness and communication. In summary, helping a woman reach orgasm is a multifaceted process. Proper clitoral stimulation, gentle engagement with the G-spot, emotional connection, and attentiveness to her responses are key. Treat your partner with care and patience, and pleasure will naturally follow. If you found this video helpful, please like the channel and leave your comments below. Share any insights or experiences you've had, whether you've successfully helped your partner reach orgasm, or if these statistics surprised you. Your feedback contributes to a better understanding of female sexual health. Thank you for watching, and I'll see you in the next video.